So Florida Hospitals had a journey over the last 10 years of implementing our electronic health record. We actually decided to work with CSI early on in our project as we were looking for some of those technology folks. CSI was able to bring to us very skilled people who knew the applications that we were working on, sometimes better than our own staff did because they'd been working on them for many years already. And so CSI was able to bring those skilled people to us. So when it came time to do the implementation and we needed to find over 125 people one time for a project to do physician order entry, I naturally thought of CSI as the person or company to turn to because they'd done such a good job in bringing us skilled resources to date. That project was a large challenge to onboard 125 consultants at one time for over a 4-week period, and the scheduling of that and finding the skilled resources, getting them all into the Orlando community to support us through that time took a large team of people and tight coordination between Florida Hospital, those consultants, and CSI who really ran that for us and took that responsibility off my team's shoulders so they could focus on the technology and making sure everything was really ready for implementation. When we first began our journey into the electronic health record, we were already in the process of using multiple vendors to supplement our workforce at Florida Hospital. And so what really stood out as we went through that was the quality of resources that CSI brought when we needed someone to help on the technology side. So when we had to turn around and find 125 plus people for a 4-week period of time, the first place we went was to CSI, and that was to ask, do you think that you can actually find that many resources and get them here in this time period? If you don't, we'll turn to some of these other vendors as well and ask them for some support, but we wanted to go through CSI first because, one, we'd already had an established relationship where they'd provided skilled resources for us consistently, so we had a high level of confidence that they would be able to do that again. In addition to that, CSI was very competitive in their rates, and they were willing to negotiate those rates in order to find something that was workable for us as an organization. And being a healthcare provider that's a nonprofit business, we really try to be as cost effective as we can. It was an interesting process as CSI came in and did the training and support of our end users with our large implementation. And one of the ways that I measure success of that is our physicians, for example, today are used to having people who are employed by Florida Hospital at their side on a daily basis, or as we do small changes to the system. And we actually call those people red shirts because they walk around in red shirts. When we brought CSI in, we actually put those people in red vests. So as a physician was walking down the hall, they would know a person in a red shirt or a red vest could actually help them. And it was so interesting and wonderful to see that our physician feedback after that was that those people in those red vests were equally as valuable to them as the people that they had worked with every day in the red shirt. So that again just spoke to the quality and the training that CSI did of the consultants they brought in to support us, because our end users said they were equally as valuable to the people who worked here every day. So the skill set that the CSI team has brought forward to us has really been recognized by my management team who works with them every day. And consistently across the board, the feedback that I get from those managers who know these applications, who know the technical skills that it takes to support them, has been resoundingly positive when it comes to what CSI has brought to us. I feel completely confident that we will continue to use CSI as our primary source for resources outside of Florida Hospital.